What if one of the biggest threats to your heart after 60 isn't hidden in your diet, but sitting quietly in your medicine cabinet? Millions of older adults take medications every day to manage pain, allergies, blood sugar, hormones, and other common health concerns. Many of these medicines are helpful and sometimes essential, but as we age, the body processes medications differently, and certain pills may carry a higher risk of heart attack, stroke, high blood pressure, or dangerous drug interactions in some people. In this video, we'll explore 5 types of medications that deserve a closer look after age 60, the warning signs you should never ignore, and the lifestyle habits that can help support healthier blood vessels, better circulation, and long-term heart health. This isn't about fear, it's about becoming an informed partner in your own health journey and making choices that support both longevity and quality of life. Many people assume that if a medication has worked well for years, it will continue to affect the body in exactly the same way forever. But after the age of 60, our bodies naturally go through changes that can influence how medicines are absorbed, distributed, broken down, and removed. The liver and kidneys, which play major roles in processing medications, may work less efficiently with age. This means some drugs can remain in the body longer, increasing the chance of side effects or interactions. At the same time, blood vessels become less flexible, the heart may become more sensitive to changes in blood pressure, and the body's ability to recover from stress can gradually decline. These age-related changes do not mean medications are unsafe, but they do mean that regular reviews become increasingly important. Research suggests that older adults often benefit from periodic discussions with their healthcare provider about whether each medication is still necessary, whether the dosage remains appropriate, and whether newer treatment options may offer advantages. Nutrition also plays a meaningful role in supporting healthy aging. Eating a balanced diet rich in vegetables, fruits, whole grains, beans, healthy fats, and lean sources of protein can help support heart health, blood vessel function, and overall metabolism. Staying well hydrated may also help the body process medications more effectively, particularly during hot weather or illness. Regular physical activity, even something as simple as a daily walk, can support circulation, healthy blood pressure, and muscle strength, all of which contribute to better overall resilience. Good sleep and stress management are equally valuable because they influence hormones, immune function, and cardiovascular health. It's also wise to keep an updated list of every prescription medication, over-the-counter product, vitamin, and herbal supplement you take, since combining multiple products can sometimes create unexpected interactions. Taking medications exactly as prescribed and avoiding changes without professional guidance helps reduce unnecessary risks while allowing treatments to provide their intended benefits over time. As we grow older, it becomes increasingly important to understand that not every medication affects the heart in the same way. Some medicines that are appropriate for one person may require extra caution for another, especially when cardiovascular disease, high blood pressure, diabetes, or kidney problems are already present. 5 categories often discussed with healthcare professionals include certain nonsteroidal anti-inflammatory drugs used for pain relief, some decongestants found in cold medicines, certain forms of hormone therapy, specific diabetes medications depending on the individual treatment plan, and medications that may raise blood pressure as a side effect. None of these categories should be viewed as universally harmful because their benefits may outweigh their risks for many people. The key is understanding that individual health history, dosage, treatment duration, and interactions with other medications all matter. Research suggests that regular medication reviews can help identify opportunities to reduce unnecessary risks while maintaining effective treatment. Reading labels carefully is another valuable habit, since over-the-counter products sometimes contain ingredients that affect blood pressure or interact with prescription medicines. Nutrition also supports cardiovascular health alongside appropriate medical care. Meals centered on vegetables, fruits, legumes, whole grains, nuts, seeds, and healthy fats provide nutrients and plant compounds associated with healthy blood vessels and balanced cholesterol levels. Limiting highly processed foods that are high in sodium may also help support healthy blood pressure. Daily movement, such as walking, cycling, swimming, or gentle strength training, can improve circulation and help maintain heart health when performed consistently and safely. Avoiding tobacco, limiting excessive alcohol consumption, managing stress, and getting enough sleep are additional lifestyle habits that work together with medical treatment rather than replacing it. If you ever experience chest pain, sudden weakness, difficulty speaking, or other possible warning signs of a heart attack or stroke, Seek immediate medical attention instead of assuming a medication is simply causing temporary discomfort or waiting for symptoms to disappear on their own naturally. One of the most valuable skills you can develop after the age of 60 is recognizing when your body may be signaling that something needs attention. Many medication side effects begin with subtle changes rather than dramatic symptoms. You might notice unusual dizziness, persistent swelling in the legs, unexpected fatigue, shortness of breath during routine activities, a rapid or irregular heartbeat, or blood pressure readings that are consistently higher than normal. These symptoms do not automatically mean a medication is causing harm, but they deserve timely discussion with a healthcare professional. Equally important is understanding drug interactions. Prescription medicines, over the counter products, vitamins, herbal supplements, and even certain foods can influence how medications work. For example, combining multiple products that affect blood pressure, increase bleeding risk, or cause drowsiness may lead to unwanted effects. This is why keeping an up to date list of everything you take can be extremely helpful during medical appointments and pharmacy visits. Reading medication labels carefully and using one pharmacy whenever possible may also reduce the chance of unexpected interactions. Nutrition supports this process by helping maintain overall cardiovascular and metabolic health. A balanced eating pattern rich in vegetables, fruits, whole grains, legumes, nuts, seeds, and healthy sources of protein provides nutrients that support healthy circulation and immune function. Staying hydrated is equally important because dehydration can sometimes influence blood pressure, kidney function, and the way certain medications are processed. Regular physical activity, appropriate for your fitness level, can help you become more aware of changes in endurance or breathing that may deserve medical attention. Home monitoring tools, such as a blood pressure monitor, can provide useful information between appointments when used correctly. If you experience sudden chest pain, weakness on one side of the body, trouble speaking, severe shortness of breath, or sudden vision changes, these could be signs of a medical emergency requiring immediate care rather than waiting to see whether the symptoms improve or become less noticeable over time. While medications can play an important role in managing health conditions, everyday food choices and lifestyle habits also have a powerful influence on the heart and blood vessels. Research consistently suggests that eating a variety of colorful vegetables and fruits provides vitamins, minerals, fiber, and plant compounds that help support normal blood vessel function and protect cells from oxidative stress. Whole grains, beans, lentils, nuts, and seeds contribute additional fiber and beneficial nutrients that may help maintain healthy cholesterol levels and support balanced blood sugar. Fatty fish such as salmon, sardines, and trout provide omega-3 fatty acids, which have been associated with heart health when included as part of an overall balanced diet. Replacing highly processed foods with minimally processed options may also help reduce excess sodium and added sugars, supporting healthier blood pressure and metabolic function. Staying physically active is another essential habit. Regular walking, cycling, swimming, or strength training helps improve circulation, supports healthy body weight, and encourages better insulin sensitivity. Even short periods of movement throughout the day can add up over time. Sleep deserves equal attention because poor sleep has been linked with changes in blood pressure, inflammation, and metabolism. Creating a consistent bedtime routine and limiting caffeine late in the day may help improve sleep quality. Managing stress is equally valuable since chronic stress can influence heart health through multiple pathways. Simple practices such as deep breathing, spending time outdoors, connecting with family and friends, or enjoying meaningful hobbies may help support emotional well being. Avoiding tobacco and limiting excessive alcohol consumption are additional steps that can reduce strain on the cardiovascular system. These healthy habits are not intended to replace prescribed treatments, but to work alongside them, helping create an environment where the body functions more efficiently. Over time, small daily decisions often become meaningful long-term patterns, supporting resilience, healthy aging, and better quality of life, while complementing guidance from trusted healthcare professionals and regular preventive care throughout every stage of aging. One of the simplest yet most effective ways to protect your health after the age of 60 is to schedule regular medication reviews with your healthcare provider. As new medical conditions develop or existing ones change, the medicines that once seemed ideal may need adjustments. A medication review gives you the opportunity to discuss every prescription drug, over-the-counter medicine, vitamin, herbal supplement, and nutritional product you use. This complete picture helps identify possible interactions, duplicate therapies, unnecessary medications, or opportunities to simplify your treatment plan. It is also a chance to ask whether each medication is still appropriate for your current age, kidney function, liver health, and cardiovascular risk profile. Bringing an updated medication list or the original containers to your appointment can make these conversations more accurate and productive. Preparing questions in advance, such as whether a lower dose might be suitable or if there are lifestyle changes that could support your treatment goals, encourages shared decision making. Nutrition also deserves a place in these discussions because certain foods and beverages can influence how medications are absorbed or metabolized. Eating a balanced diet rich in vegetables, fruits, whole grains, legumes, healthy fats, and lean proteins supports overall health and may complement medical treatment. Staying hydrated is equally important, particularly during illness or warm weather, because dehydration can affect blood pressure and kidney function. Maintaining regular physical activity, getting enough restorative sleep, and managing stress all contribute to better cardiovascular and metabolic health, making medications part of a broader strategy rather than the only solution. Never stop taking a prescribed medication simply because you read about possible side effects online or heard someone else's experience. Individual circumstances vary greatly, and treatments should always be tailored to personal needs. Working closely with your healthcare team allows decisions to be based on your complete medical history, current health status, and long term goals, reducing unnecessary risks while helping you receive the greatest possible benefit from appropriate treatment over time. Growing older offers an opportunity to become intentional about protecting your heart and brain every day. While no lifestyle can eliminate every health risk, consistent habits can support long term cardiovascular wellness and aging. Start by making heart-friendly nutrition a daily priority. Fill your plate with colorful vegetables, fruits, whole grains, beans, nuts, seeds, and healthy fats like olive oil, while choosing lean protein sources and limiting processed foods high in sodium, added sugars, and unhealthy fats. These eating patterns have been associated with healthier blood vessels, improved cholesterol balance, and better metabolic health. Regular physical activity is equally important. Walking, swimming, cycling, or strength exercises suited to your abilities can improve circulation, support healthy blood pressure, maintain muscle mass, and help regulate blood sugar. Staying active also benefits mood and cognitive function. Quality sleep should never be overlooked because the body performs essential repair processes overnight. Aim for a consistent sleep schedule and discuss persistent sleep problems with a healthcare professional. Managing stress through relaxation techniques, social connections, enjoyable hobbies, or time in nature may also support heart health over time. Keep routine medical appointments, monitor your blood pressure if recommended, and stay current with preventive screenings that match your age and health history. If you take medications, follow instructions carefully and communicate any new symptoms or concerns promptly instead of making changes on your own. Staying hydrated, avoiding tobacco, and limiting excessive alcohol consumption further contribute to cardiovascular wellness. Perhaps the most empowering habit is staying curious and informed. Ask questions during appointments, learn about your conditions, and understand why each treatment has been recommended. Knowledge helps you make confident decisions alongside your healthcare team, creating a partnership focused on prevention, resilience, independence, and enjoying the years ahead with greater strength, confidence, and vitality while embracing healthy choices every day. Getting older doesn't mean becoming powerless. In many ways, it means becoming wiser about the daily choices that shape your future health. The medications you take, the foods you eat, the way you move, the quality of your sleep, and the questions you ask your healthcare team all work together to influence the health of your heart and brain. The goal is not to avoid treatment, it's to make sure every treatment still fits your current needs and helps you live as well as possible. If there's one takeaway from today's video, let it be this: stay informed, review your medications regularly, and build a lifestyle that supports strong blood vessels, healthy circulation, and long-term vitality. Your health after 60 is not determined by one pill or one decision. It's shaped by the habits, knowledge, and actions you practice consistently every day. Thank you for watching, and I'll see you in the next video.